The fungal infection of skin and soft tissue are classified into three categories: superficial mycosis, subcutaneous mycosis, and opportunistic mycosis of skin and soft tissue. Superficial mycosis, these are the fungal infections involving skin, hair, nail, and mucosa. Skin, hair, nail और mucosa का infection is superficial mycosis. Example include tinea versicolor, tinea nigra, Piedra, and dermatophytosis. Superficial mycosis involves the infection of skin, hair, nail, and mucosa. Skin, hair, nail, and mucosa. Examples include tinea versicolor, tinea nigra, Piedra, and dermatophytosis. Example of superficial mycosis: tinea nigra, tinea versicolor, Piedra, and dermatophytosis. This is the infection of skin, hair, nail, and mucosa. Subcutaneous mycosis. These are the mycotic infections of the skin, subcutaneous tissue, and sometimes bone, resulting from inoculation of saprophytic fungi of soil or decaying matter. तो subcutaneous mycosis में skin, subcutaneous tissue, sometimes bone, इन सब का infection होता है, and this is because of the inoculation of saprophytic fungi of soil and decaying matter. They are mainly confined to the tropics and subtropics. Example include mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Subcutaneous mycosis. These are the mycotic infections of the skin, subcutaneous tissue, and sometimes bone. And this is because of the inoculation of saprophytic fungi of soil and decaying matter. ये tropics और subtropics तक confined होता है mainly. Example of subcutaneous mycosis: mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Example of subcutaneous mycosis: mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Opportunistic mycosis of the skin and soft tissue. They can act as human pathogen in presence of opportunities like low immunity. Example HIV infected individuals. तो जिन individuals का immunity low है उनमें they will act as a pathogen. Example of opportunistic mycosis: Penicillium marnefi infection, candidiasis, which is cutaneous and mucocutaneous. Cutaneous mucormycosis, cutaneous aspergillosis, and cutaneous cryptococcosis. ठीक है, तो जो स्किन और सॉफ्ट टिश्यू का फंगल इन्फेक्शन है वो तीन कैटेगरीज में डिवाइड हो सकता है: सुपरफिशियल माइकोसिस, सबक्यूटेनियस माइकोसिस और ऑपर्चुनिस्टिक माइकोसिस. सुपरफिशियल माइकोसिस ये स्किन, हेयर, नेल और म्यूकोसा का फंगल इन्फेक्शन है. सुपरफिशियल माइकोसिस का एग्जांपल है टीनिया नाइग्रा, टीनिया वर्सिकलर, पिएड्रा एंड डर्मेटोफाइटोसिस. टीनिया नाइग्रा, टीनिया वर्सिकलर, पिएड्रा and dermatophytosis. Subcutaneous mycosis: this is the mycotic infection of skin, subcutaneous tissue, and sometimes bone, and this is because of the inoculation of saprophytic fungi of the soil or decaying matter. Subcutaneous mycosis is confined mainly to the tropics and subtropics. इसका एग्जाम्पल है mycetoma, sporotrichosis, chromoblastomycosis. See, mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Rhinosporidiosis, microsporidiosis, mycetoma, sporotrichosis, chromoblastomycosis. Mycetoma is an example of subcutaneous mycosis. Mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis, and microsporidiosis. Rhinosporidiosis, microsporidiosis, chromoblastomycosis, spirotrichosis, and mycetoma. Example of opportunistic mycosis: Penicillium malneae, candidiasis, cutaneous mucormycosis, cutaneous aspergillosis, and cutaneous cryptococcosis. Penicillium malneae, candidiasis, cutaneous aspergillosis, mucormycosis, and cryptorcoccus. These are example of opportunistic mycosis.